over the antigen. The rest of the reported positive tests were through antigen detection, which is known to result in false positive for seasonal influenza when the incidence of flu is low, like it was this year. Across the nation, there was a 6-fold increase in testing at public health labs, most of which test for influenza A and B, along with COVID-19. Even so, there was a drop in flu cases nationally. The CDC recommended healthcare professionals test patients who have COVID-19-like symptoms for both flu and COVID-19, because it is impossible to differentiate between the two viruses without testing, and patients can have both viruses at the same time. The department's epidemiologists continue to monitor and compare statewide flu activity with national flu activity. For reference, the CDC reported that seasonal flu activity in the U.S. remains lower than usual this year. Earlier, I briefly mentioned that flu vaccinations played a huge role in our lower case count that we have seen this year. While flu vaccines are not reportable to our department, as of February 12th, the CDC reported 193.8 million doses of flu vaccine have been distributed across the United States. This surpassed the previous record of 174.5 million doses distributed during the 2019-2020 flu season. The CDC will update the number of flu vaccines distributed across the country through the end of flu season. The flu vaccines are available in Pennsylvania as a shot for anyone 6 months or older, and as a shot or nasal spray for anyone 2 years or older each year. Flu vaccines are typically available at doctors' offices, pharmacies, local clinics, or grocery stores through the end of flu season. In addition to getting vaccinated, Pennsylvanians practiced great health habits, such as covering your mouth and nose when sneezing, frequently washing hands, and remembering to disinfect commonly touched objects, including doorknobs, light switches, countertops, cell phones, and computers. Practicing those healthy habits plus COVID-19 safety measures, such as getting the COVID-19 vaccine, wearing masks, and responsibly social distancing, were all factors that kept our flu case count low. We encourage Pennsylvanians to download the COVID Alert PA app to monitor both flu and COVID-19 symptoms by tracking the symptoms daily in the check-in feature on that app. While we are highlighting steps that work to keep flu activity low this season, we must remember to take similar proven public health measures like washing hands, keeping physical distance, and even wearing a mask to minimize the spread of infectious respiratory diseases in the future. Though the flu season is over, let's continue to do our part to stop the spread of flu as well as the spread of COVID-19. Thank you, and I will now take questions.
Thank you. Again, we will be using the raised hand feature, so when you go ahead and raise your hand, we'll get started with the questions. I see our first one is from Stacy Burling. So Stacy, you can ask your question.
Hi, I know we're only supposed to ask one question, but I do have a couple, so you can answer as many as you want, I guess. One is, you say that this is comparable to the 2015 season, and I don't know what comparable means. Do you mean it's the same number of cases, and wasn't there less testing then? Next question is, do we have any reason to think that now that we're all out getting together again, that flu could be spread in the summer this year? And last question is, the season was also very low in the parts of the world where we usually decide where, what the vaccine for next season will cover. Do you feel confident that we'll be able to get an accurate flu vaccine for next season? That's it.
Thank you. I will try to answer those questions. First and foremost, yes, we were in the same general area that we were at in regard to numbers in our 2015-2016. In the 2020-21 season was comparable to the 2015-2016 season in regard to our overall numbers. However, you are correct in identifying two variables. Number one, we did do more testing this season, and number two, we did see more persons going out, and getting vaccinated. Number two, you asked about the summer season. Typically, this is where flu does dwindle off at this particular moment. However, we will stress to the public to please keep up with the various actions that you have taken over the past months in regard to your public health. These include washing your hands. This includes social distancing when appropriate. And this includes going to a healthcare provider when you feel like you're not feeling well. In regard to the last element of your question, I simply don't have an answer for that at this moment in regard to future vaccines. And I think that that answer will become clearer as we move into the next flu season. But thank you.
Thank you. Our next question is going to be from Mick Stinelli, and he is with the Post-Gazette. So, Mick, you can ask your question.
Hi, thanks. Good afternoon. I had a question in regards to mask wearing. What is the likelihood that, for this flu season coming up at the end of the year, the health department recommends mask wearing for, if you have symptoms or even if you're asymptomatic during flu season?
That's a great question, and I appreciate you asking the question. I can't speak to whether we would mandate mask wearing for upcoming flu seasons. What I can say is that I believe we've learned a lot of lessons in regard to public health actions and as we move forward. And some of those lessons include masking up when you're symptomatic or potentially masking up when you're in a public place and symptomatic, washing your hands, utilization of hand sanitizer, even social distancing in specific circumstances. So I cannot speak to what the department would mandate or even require in the future, but I can say that we all learned that we have a stake in the general public health, and our individual actions impact the public health. And those actions, including mask wearing, are things that we should contemplate personally as we move forward after COVID-19. Thank you.
Up next, we have Seth Kaplan from ABC 27.
Hey, thanks for taking the question. I'll maybe try to sneak into. My main question is shaking hands and other things like that, which have probably also, the absence of those things anyway, which have probably also contributed to not spreading things other than COVID. Should we be thinking about that going forward? I mean, just what can I as a citizen think about next flu season, even if the COVID threat has mostly passed, in terms of just ways to live my life in a way that I'm not going to catch the flu? And my other question was just going to be flu shots. I know I got my flu shot in August. The first time I walked into a pharmacy and I saw the flu shot was available, I was like, yeah, get that in my arm. I was somebody who used to dawdle. I wonder if the timing of flu shots, in addition to the volume, was also helpful. Other people who were just really careful this year.
So I'll address your first question first, and thank you for bringing up that important aspect of our public health actions. I believe that it's prudent to reflect on actions like that, including shaking hands, as we move forward off of the COVID-19 pandemic. I believe that we should probably look to that. When I had spoken about your personal responsibility in regard to public health, we should probably look at that as well as one of those general areas. I am not telling people to not shake hands. I am telling people to think about it as we move forward off of COVID-19, much as I think we need to think about sneezing publicly and how to handle that, washing your hands, disinfecting those commonly utilized objects that other people might utilize as well, wearing a mask and social distancing under certain circumstances. So thank you for bringing up that important element. In regard to timing, I will say this. The most important thing is to get your flu shot every season. I appreciate that you self-identified as a person who dawdled on it. I believe those were your words. And I think I would applaud you for not dawdling this season and for going ahead and getting that flu shot. And that should be our lesson. That is our lesson to the general public. Please go out, get a flu shot, get vaccinated. It doesn't matter when you get it. It matters that you get it. Thank you.
Thank you.
And next, we have David Winter from Penn Live.
Thank you. Is it possible that flu cases and flu deaths, perhaps a lot of them, got counted among our COVID-19 infections and COVID-19 deaths?
So one of the things the department recommended and the CDC recommended as well, was healthcare professionals testing patients who have COVID-19 symptoms for both flu and COVID-19. I would say the short answer is I don't believe it is possible. And I would say that the longer answer is that we recommended to healthcare professionals to always test, and that was something we were keeping a close eye on. Our COVID-19 numbers, our COVID-19 hospitalizations, people who are in intensive care, and clearly our COVID-19 deaths. And at the same time, our epidemiologists here at the state, as well as our lab folks here at the state, were keeping a close eye on both COVID numbers as well as flu numbers. Thank you.
Next, we have Paul Go from the Pittsburgh Business Times.
Hi, Ray. Thanks for taking the time. Two questions. One, do you have any numbers on how many people had been had tested positive for both COVID and the flu at the same time? I know that there were some concerns of clinicians that could possibly be the case, and you'd be in worse shape than you would even with either of those. And then the other question I had was, what are the plans for next year? Obviously, the drug companies are still formulating the vaccines, and it will probably be more difficult given that there's not a flu track record, as it were. But what are you trying to do to make, beyond the personal responsibility aspect of it, to kind of get ready for next year's, to kind of have maybe the same type of, and maybe you think that it'll be higher because there won't be as many people masked?
So in regard to your first question, I simply don't have that number. I believe that if you needed to, you could probably follow up with our press office, or we can follow up with you afterwards in regard to the patients who had both COVID-19 as well as influenza. In regard to your second question regarding the 2021-2022 flu season, we begin monitoring flu trends over the summer, and we also work with the CDC as well as the states around us to monitor those flu trends as well for anything unusual. You are correct that a vaccine is still being developed at this moment, so I can't really speak to that. What I can speak to is here at the department, we take flu extremely seriously. In the past, we've actually worked with an internal and external working group that takes our subject matter experts here, as well as other subject matter experts in Pennsylvania, various societies and other offices, and we marry them when we have flu move above the epidemic threshold here in Pennsylvania. And we look at things like trending. We look at where we're seeing vaccine distributed and where we're not. And we also look at other states for best practices. Whereupon we see that developing next year in regard to our flu season, we will move into that emergency mode like we've done in previous years.
And next we have Julia Felton from the Tribune Review.
Given the emphasis on COVID-19 and COVID-19 testing availability this year, do you believe that there could have been many instances where an individual tested positive for COVID-19 and did not go that extra step to also be tested for the flu? And could that have resulted in flu cases going uncounted and unrecognized?
I think that that's an interesting hypothetical, one that I probably don't have an answer to in the moment. I will tell you this. When patients presented to their healthcare providers with flu-like symptoms, or as we call it, influenza-like illness, we recommended, and the CDC recommended, that those healthcare professionals test them for both COVID-19 as well as flu. That's what we're reporting out to you. Everything that we've become made aware of in regard to our statewide surveillance system. So it's a hypothetical, one that I can't potentially answer exactly the way you want me to. The way I will answer it is that we did recommend that healthcare providers tested for both because we wanted to avoid situations such as what you just mentioned. Thank you.
Next, we have Scott Beveridge from the Observer Reporter.
I apologize for asking you to go back and review some of those numbers that you started out with. 3,664 cases of flu and 21 deaths. When did that happen?
That was as of May 22nd, and that has been this flu season. Those are the numbers we've seen this flu season. 3,664 laboratory confirmed cases and 21 flu-associated deaths.
Okay. And the the record number of people who got the flu shots? Were there numbers associated with that? I was a little late getting in here.
No, you're fine, and I appreciate you asking the question again. Flu vaccines are monitored by the CDC, and this is CDC information that's typically passed to the state of Pennsylvania. As of February 12th, the CDC had reported 193.8 million doses of flu vaccine across the United States. I believe on the CDC's website, there's a dedicated page for the 2020-2021 flu season, and they update that regularly in regard to the overall number of flu vaccines that they've distributed across the U.S.
For the 193.8, is that what kind of an increase is that?
I believe the previous record was 2019-2020, and that was 174.5 million.
Okay, thank you very much. I'm sorry.
No apology needed. Thank you.
Okay, we're going to wait a moment to see if there's any additional questions at this time. And if you have one, please raise your hand. Okay, Mick, we will go back to you. You can unmute.
Thanks. It's sort of a follow-up on that last question. I see the national numbers on the CDC's website, but do we have any numbers specifically for how many people received the flu vaccine just in Pennsylvania?
We don't.
Okay.
We typically rely on CDC's information in that regard. Thanks.
Okay, thanks.
And we'll go back to Paul Go next.
Hi, thanks. Ray, do you know, can you put this into perspective? You mentioned 2015's flu season, but what is the lowest on record that you have, and how far back do those records go in terms of cases in PA here?
So I'm led to believe this is the lowest on record, but I think the prudent move is, why don't I have my press office reach back out to you with those questions so that I do not fumble them?
Up next, we have Julia Felton.
Thank you. Can you compare the number of flu tests that were administered this year to the number of COVID-19 tests administered over the same time frame?
What I can tell you is that across the nation, we saw a six-fold increase in regard to our testing for flu at various public health laboratories. COVID-19 is a new infectious disease, so making that sort of comparison is a little difficult in the moment. We can get back to you with further figures, though, if you want.
And next is David Winner.
I've seen some national stories that have pointed out that the flu cases have been really down, as in Pennsylvania, and they also said that basically colds, were really down. And we know there's logical reasons for that. But the other side of that is that people might wind up being less immune to those things because they've been away from them for a while. And I'm just wondering if there's any thoughts or concerns about that in Pennsylvania.
That's a great question, and I appreciate it. I think this is one of those areas where we need to, even press conferences like this, really heighten public awareness in regard to various infectious diseases. And so whether you're talking about your common cold, such as what you just mentioned, or even the season's influenza, or even COVID-19, it's those same actions that are going to assist us in regard to how we're dealing with it. And when we speak to those actions, it's the, covering your sneeze, covering your cough, washing your hands, the utilization of hand sanitizer, even wearing masks, or getting to a healthcare provider when you don't feel well. Those are the critical actions that the public needs to take as their part in the overall public health. I think that you've made a good point in regard to people potentially being exposed to something that they weren't exposed to because we've all been indoors for a while. But at the same time, it's going back to those basics that I just mentioned that's going to be our first weapon in this fight.
Thank you. And that's all the time we have today. A press release did go out on this topic, and we will have a PA cast available later on. Have a great Memorial Day weekend.